Hello, future nurses. Kamusta na po kayo? And we are now down to the last topic of our fundamentals of nursing in RLE. So, for this topic, we will be talking more about medication administration. And because of the situation, I just don't know what we are going to do with the return demonstration since administration of medication needs a very close supervision of the students when it comes to administration of medication, especially the injectable forms of medication. But anyway, our main objective for this particular topic as of this time is just to give you the knowledge that you need, and as far as the administration of medication is concerned, and at the same time this will also equip your knowledge with the preceding years, no, of your nursing career, and specifically the knowledge when it comes to administering the drugs. So just go over with these slides and take note of some important things, and because also this will be your topic for finals, and there are some exercises expect, no, so it can be given online as part of your final grade, no, for this particular subject. So all throughout this particular topic you have to remember these four basic concepts as far as medication administration is concerned. One, we have to see to it or take into consideration that all medications are available in a variety of forms. Now, speaking of these forms, now we have so many forms of medications. No? Just to give you some example, now there are medications that are orally prepared. No, when I say orally prepared, so these are medications that are or can be administered by mouth, no? Just like the tablets, the capsules, no? The caplets, no? And pediatric medications orally, no? Given by mouth. We also have parenteral routes, no? It comes in a variety of forms. You see parenteral, you can have these medications via IV or intravenous fluid. Parenteral routes can also be given injection, no? Intramuscularly, okay, in direct into the muscles, no, intradermal or subcutaneous, no. These are some of the examples, but we have to dig deeper into that, no, in the preceding slides, no. For the meantime, let's have this number two concept. No? The form of medication determines its routes of medication or administration rather. No? So that means medications are being prepared, or the forms of medications has its relation as far as the administration of this medication is concerned. No? We have, like for example, we have the vials. No, usually medication that comes in vials are administered through IV, no? Whereas medications that are prepared in a bottle, no? Just like the vitamins, no? Or those who are prepared in the form of capsules and tablets, these are usually administered orally, no? For number three, you have to take note that composition of medication affects or enhances its absorption and metabolism, no? So medications that are administered orally are usually absorbed longer compared to those medications administered parenterally, no? And when it comes to absorption, uh, usually drugs that are given orally or via the mouth are absorbed via the GI tract, no? Or the main point of absorption is the stomach. And in terms of metabolism, there is one major organ that functions in terms of metabolism of drug, no? And that is the liver, no? If you remember in your anatomy. The last concept, many medications come in several forms, so be certain to use the proper form, no? Most of us, no, if not all, nurses must know how this form of medication is being administered now, because we cannot take for granted now if we are going to administer a certain medication with its wrong or incorrect form, no. So it is one of the mortal sin, no, of us nurses, no, or future nurses, no, if we administer the drugs uh, incorrectly as far as its form is concerned. So make sure that you have to administer this drug correctly. Okay, I have mentioned the medication forms. Now, these are the most common forms of medications now that are available in the market. Now, we have the couplet. Now, couplet usually is colored white now, shaped like a capsule, but the external or the outer portion is slightly different from that of a capsule, no? And it is coated for a sheer swallowing, no? If you are familiar with Tylenol, no? So it comes in a couplet form, no? Although it's not available here in the Philippines, no? But if you heard one of the antibiotic cotrimoxazole, no? That is another example of a medication in a couplet form. The second one is the capsule. No? This is the most common. No? Capsule is a powder or liquid or oil, no, that is in a gelatin form or gelatin shell. No? Most of the antibiotics usually comes in capsule. No? If you heard cefalixin, amoxicillin, ampicillin. Okay, so these are the most commonly used antibiotics that usually comes in capsule. No? For the tablet, no, these are compressed powder. No? Most uh, drugs that comes in a tablet form is paracetamol. No? Paracetamol comes in tablet form. Vitamin C, no, ascorbic acid. It also comes in tablet form. Although there are ascorbic acid that comes in capsule, no? But there are also ascorbic acid that comes in tablet. Enteric-coated, no, these are forms of medications that usually dissolves in the small intestine. Most commonly used lozenges or most available lozenges is now, if you heard, strepsils. No? Strepsils is one of the example of lozenges. No? Elixir, this is mixed with water or alcohol and sweetener. No? Example natin dito is MGP. No? We also have the syrup. No? These are medication dissolved in a sugar solution. So syrup usually comes in a bottle, but also has a different flavor. No? So the reason why it comes in a flavored solution, since most of the syrups are usually consumed by pediatric clients, no, or children. So kailangan nila ay medyo masarap ang panlasa, no? Another form is suspension. So these are drug particles in a liquid medium left alone will settle in the bottom, no? Suspension drugs, no, they are prepared uh, in solid form, no? But you have to add a certain amount of water to it in order for them to be called suspension form, no? uh, Amoxicillin and cephalexin, also ampicillin, no, vials, no. Kaya pag nakakita kayo ng mga gamot na hinahaluan ng tubig, tapos you have to shake that, then we are very sure that that is a suspension form of medications, no? So as what I have said, most common example, amoxicillin, antibiotics, cephalexin, and ampicillin. We also have solution. So these are syrup preparation that contains water and one or more dissolved compounds. No? So solution can be given IM or intramuscular. No? SQ is subcutaneous and IV is intravenous. No? Solution, example, Orisol, no? Oral rehydration solution. Uh, if you remember, Orisol are given for those patients who have gastroenteritis, no, with some manifestations of excessive vomiting and passage out of liquid stool, no, liquid and watery stool, or diarrhea in short. No? Solution, another example is intravenous fluid. No? These are solutions, no, given to patients who are of fluid volume deficit. No? Patient na nabawasan, no, yung tubig sa katawan nila. They usually need the solution. Okay? Dilution, the next one, no, lotion, no? Liquid suspension for skin, no? So ito yung mga ina-apply natin sa balat, no, to take care of a certain type of disease, no. Just like for example, ano bang mga lotion natin dyan, na example ginagamit natin pag may example skin disorders, na, so mayroon tayong mga lotions, na calamine lotions, na usually ginagamit pag you have skin allergy, okay? You have skin diseases like eczema, no? You have to put some lotions. Ointment, okay? Ointment can be used also for uh, skin diseases, no? If you have burns, no? Then we can apply this ointment, no? To relieve some manifestations of pain and at the same time as treatment for that certain disorder. So for the paste, no, these are semi-solid but thicker than ointment, no, and what makes it different from ointment, this form of medication has slower absorption, no, compared to the ointment that has a faster absorption rate. Then we have also transdermal patch. No? These are semi-permeable membrane discs or pots applied to the skin. No? Most commonly used pots is for burns. No? We have, if you heard Tagaderm, no? These are transdermal pots. No? For burns, you also have transdermal pots for chest pain. No? And the most common or the most widely used brand there is nitroglycerin, no? Transdermal pots. These are usually applied to the skin to lessen some manifestation of chest pain in the client. No? Then we also have suppository. No? I hope you heard this suppository. No? Commonly used by female, no? For the purpose of maintenance of the so-called feminine hygiene. So we have, this is also a solid drug mixed with gelatin inserted into parts of the body cavity, no? Commonly the rectum and the vagina. No? So what I have said, for some uh, reasons or to maintain the homeostasis, no, as far as the pH of the rectum or the vagina is concerned. Then we have the pharmacokinetics, no, of a certain drugs. So when we say pharmacokinetics, we are speaking of the following, no? The route, the absorption, distribution, the action, metabolism, and the excretion of drug, no? So speaking of the route, no? So that means how are you going to administer the drug so that it can enter the human body. So route of administration, I have mentioned before, orally, parenterally, okay, through injection or through intravenous. Those are some example of the routes. For absorption, so this is, or it refers to the drug from the time it is being administered, no, up to the time that it is being consumed by the body. No. It's the absorption. For the distribution, no, so we have three different areas for distribution of the drugs. No. Blood into the cells, then blood into the tissues, and blood going into the organs. No? A certain drug is distributed, no, to a certain area wherein it has to exert its action, no? Or it has to exert its healing effect. No? So, in other words, the drug must be distributed in the area of the body na kailangan niya doon ang epekto niya. Just like for example, no, this drug is for, let's say, headache. No? So it will be distributed by from the blood, no, going into some part of the nervous system, particularly in the skull area, no, in order to relieve headache. So another drug is taken for diarrhea. No? So that means this drug from the blood, it can be distributed into the GI tract, no? In order to relieve or manage some manifestations in relation to diarrhea. No? So that is distribution. No? When it comes to action, no? So each medication has a different action. No? So how the medication acts, no? Let's say you are taking the drugs for high blood pressure, no? For hypertension. The question there is, how does this medication lowers down the blood pressure? So ang sagot doon makikita mo sa action ng drug, no? So during your drug study, no, or even in pharmacology, no, we have to discuss more on this action, no? But for today, when you say action, dapat alam natin, no, the reason behind how a certain medication treat, no, a certain manifestations or a certain disease, no? That is all about action, no? Metabolism, change to prepare for excretion, no? So I have mentioned before that drug is usually metabolized in the liver, okay? So for excretion, so if there is only one organ for metabolism of drug, there is only one organ, no, that is majority of the drug are being excreted, no? And that is the kidney. Although there are other routes, no, but not, no, not as big as the amount of drug excreted in the kidney, no? So minor amount of drugs is excreted through the skin as well as the uh, genitals, no, or particularly the rectum and the skin, no? So small amount of drugs are being excreted through this. So still on the pharmacokinetic of the drug, we have to be familiar with the following terms, no? As part of the action of a certain drug. One is therapeutic effect, no? So these are the good effect, no, of the drugs because it is considered is expected or predicted physiological response of our patient, no, from the medication that they are using, no? Like for example, therapeutic effect of the drug is taken for hypertension. So what will be the therapeutic effect? Lowers down blood pressure, no? Another example, drug for fever, no? Let's say paracetamol, biogesic, tempra. So what will be our therapeutic effect? Fever will lowers down, no? Or decrease in body temperature, no? Those are therapeutic or intended effect of the drugs. Adverse effect. So sometimes you have to take into consideration that all drugs has the so-called adverse effect, no? So these are unintended, undesirable, and often unpredictable responses, no, from the medication. So adverse effect can be seen uh, in every drug, no? Especially during our drug study, no? In pharmacology. Idiosyncratic reaction, so these are also unpredictable, no? But what happens here, the patient overreacts, no? Or underreacts to a medication, no? Or has a reaction that is different from normal, no? Just like for, let's say the patient is taking drug for headache and another drug that has a side effect of headache. So pag nag-combine yung dalawang effect, yung drug for headache and the side effect of the drug number 2, then you have the so-called idiosyncratic reaction. So those are unpredictable wherein the patient reacts, no, to a medication that is different from normal. Side effects are normal part, no, of the drug. Predicted po yan. No? Just like if you are taking drugs for heart failure, no? Drugs that can increase the contractility of the heart, no? Side effect, of course, is increase in the heart rate, no? Tachycardia. So if you're going to ask your families or relatives that are taking drugs for hypertension, normal side effect is dizziness. Parang medyo nahihilo sila. So, we also have the toxic effect. These are also unintended. Usually happens to those patients who are taking drug on long term. So, toxic effect kasi meron tayong sinasabi na level of the drug in the blood, a certain level, or the maximum level of the drug, in the blood. So if this exceeds the maximum level, then it is considered that the level of the drug in the blood of our patient is at the toxic level. So that means parang sinabi na ang tawag ng mga matatanda dyan ay na-overdose, overdosage. Allergic reaction, these are unpredictable, So repeated administration wherein the patients develop allergic response. So that's why in order to prevent this unpredictable reaction, so drugs, especially antibiotics, before giving this to the patient, the physician usually orders skin testing na iti-test muna natin. So tayong gumagawa niyan, nurses na tayong gumagawa niyan skin testing to make sure that the patient will not develop allergic reaction to the drug. So because the danger behind allergic reaction, of course, is a deadly complication of anaphylactic shock. This particular slide is all about responses of the medication. So the first term is called serum half-life. From the word itself, half, that means 50%, meaning the medication, or if a certain medication reaches its 50% concentration in the blood, then that time is called the serum half-life. Parang kalahati ng effectivity rate ng gamot ay nag-take effect na sa pasyente. So, zero medication concentration is 50% acting on the patient. The second term is peak level. This refers to the time at which a medication reaches its highest concentration in the blood. So, if serum half-life is 50%, this peak level, we can say that the medication taken by the patient, it is at its 100% effectiveness level that is present in the blood. So every medication has different serum half-life as far as the duration is concerned, and also have a different peak level. The third term is called duration. So this is the total time at which the medication is present at the patient's blood. Duration usually differs from each medication. If you remember, some of the doctor ordered medication to be taken 3 times a day or 4 times a day. So each of these medication has different duration. But generally speaking of this duration, it is the entire time at which the medication is present in the patient's blood. When it comes to onset, this is the time for the drug to take effect after it is being taken. So regardless of the route that is given to the patient, each medication has its different onset. Now, the faster the onset, that means the medication is needed badly by the patient. So there are medication that has a rapid onset, and there are medication also that has an intermediate onset. No? Or this medication is under maintenance. No? The patient does not need the effect of the medication right away. The next term is throw level. This refers to the minimum blood serum concentration before the next scheduled dose. No? That's why every medications has the so-called timing. No? Timing, that means 8, 12, 4, or every 4 hours, 3 times a day, 4 times a day, every 12 hours, twice a day. Okay, that means if you are taking that medication, the serum concentration or the total level of concentration is usually scheduled after the second dose. Now, if your medication, let's say for example, is every 12 hours, so that means the total level of this certain medication is reached after 12 hours. So that's why you have to give the next dose in order to maintain the level of that certain medication in the blood. The plateau, this is the maintenance level. So if you heard patients taking maintenance level, so that means this medication needs to maintain at this level in the blood of the patient in order to control a certain medication. Like for example, antihypertensive drugs. No? So we have to reach that plateau level in order for the patient not to experience elevation in blood pressure. But once the patient cannot maintain the plateau level, then it goes up. Then the patient might have an elevated blood pressure upon your assessment. So this particular slide is a graphical presentation of a certain medication as far as the dose response is concerned. So as you can see here on the left side, plasma drug concentration. So this plasma drug concentration refers to the level of the drug at the patient's blood. Then this one in violet form or violet color is the duration. That means the total time for the medication to be present at the patient's blood. Then this is the minimum effective concentration that refers to the amount of medication level of the patient's blood in order for them to take effect. The therapeutic range, so this is the maintenance level of the medication in the patient's blood in order for them to be therapeutic or to be effective. Then this toxic concentration, so once the level of the medication reaches at this point, then you can say that the medication is a toxic level, no, on the blood of the patient, or what you call the overdosage. So we need not to let the patient level of medication in the blood to be at this level, so, since it is very difficult for the patient to be at this level, and the life of the patient may be in danger once a certain medication reaches toxic level in the blood. Next is the interaction of medication. Some medications interact with each other, because this interaction occurs when one medications modify the action of another. And in other words, there are medications, if taken at the same time, will produce the so-called synergistic effects, if combined, and the effect is greater than that of the medication that is given separately. Now, if you if you happen to see some of the patient no, in the hospital or even your relatives, no, you may ask the question why they are taking three or four or five medications at the same time. Probably one of the main reason there is the interactions. Now, when you say interactions, it can increase or decrease the effect of a certain medication. Like, for example, anti-hypertensive medications. So, this patient is taking two antihypertensive medications. One is classified as diuretic. So, when you say diuretic, it increases excretion of fluid. And the other one is beta blockers. Now, when you say beta blockers, this medication decreases the contractility of the heart. That's why blood pressure goes down. And the other one, as I mentioned, diuretic, increases urinary excretion. So when the patient increases urinary excretion, the blood volume goes down. And the end effect of that is also lower than the blood pressure. So as you can see, one decreases the heart contraction and the other one increases fluid excretion, but they have the same effect. So the effect of these two drugs is called synergistic effect. And the end result of these two drugs is only one, and that is to decrease the blood pressure. Another drug is, let's say, anti-ulcer drugs, no? Or drugs given for patient with peptic ulcer or gastric ulcer drugs. No? These drugs should be taken separately from the other, no? Because there are certain drugs that if you take this together, the effectiveness of the certain drug will be affected. No? Hindi siya pwedeng maging 100% effective. Siguro mababawasan 90, 85, 80. That's why you have to separate this drug at least 30 minutes to 1 hour before taking another drugs. So, interactions din yan. Kaya most of the drugs that is given for treatment of peptic ulcer should not be taken with the other drugs because it decreases the so-called effectiveness of the drug.